Hey there, I'm Justine Buick, the Nclex tutor, where I help nursing students pass the Nclex and their nursing exams. And so today I'm going to be talking about my book, the Nclex Nursing Nugget Pages, and how to use it for your studying. When I started tutoring, I noticed that nursing students couldn't even tell me the most basic things. And even if they've just gotten done with nursing school or they had just taken a review course, they just couldn't tell me something as simple as what does that lab value mean or how would you describe that disease. So what I started doing when I started tutoring in 2014 is I started writing my Nugget pages. And this book took me 6 years to write, where I have all the images in it and it's really organized. So I have had people buying it and then asking me, well, how should I use it to study? I don't really know how to use it. And so I thought I need to tell people how to use this book and how to study it so that you will definitely be the smartest person in your class. You will know more than everybody for sure. So this is the main table of contents for the book, and these are all the different topics. And so all of these topics are things that you would go over in nursing school. And you have your fundamentals, and you can see all the different topics here that there are. You have management of care, which is a lot of ethical and legal topics, especially those who do you see first and delegation. Another topic is safety and infection control. And so that is a really super important topic because regardless of what your patient is in for, you have to do certain safety precautions such as preventing falls. Pharmacology, oh my gosh, that is like the worst topic ever for students. And they were having so much trouble, but I'm telling you, you will love these Nugget pages for how organized they looked. And I will show you some of the meds. Then you just go through your adult health, mental health, maternity, and peds. And so those are the main topics that you would get asked about on the Nclex and your nursing exams and for all your different courses. What you'll want to do is start reading. The first topic is health and physical assessment. So just go through it, read it, make sure that you understand it as you go through it and read it. And this is really starting at the basics of what the nurse does and the nursing process, how to study diseases and conditions. So this health and physical assessment is really important because regardless of what your patient is in for, you are going to have to do an assessment on your patient. And I put all these awesome images in here to help you remember stuff because I know I'm very visual. And I have the cranial nerve face and the different parts of the brain and what they are responsible for. And you're not going to remember all of this as you go through it, but you do want to do your best to try to put this into your long-term memory. And with each part of this assessment Nugget page, I go through the different systems. So respiratory, lungs, cardiac, GI, and once again, it has all the pictures in there. Your renal, musculoskeletal, skin, and then some things about pain and how to document. Like I said, you're not going to remember all of this content, but it gives you a nice little foundation so that when you go to do your topics in adult health, you will be much more familiar with the most important things that you need to assess for. So like I said, you just want to read over that content, that topic first. And once you've read over it, then you want to go practice some Nclex style questions. And so I don't really care what you use. You can use whatever you want. If you have UWorld or the Nursing Mastery app, or you have some books from school, whatever you want to use, that's totally fine. Sometimes it's hard though to find topics specific to the topic in the book. So my favorite resource to use for that is the Saunders online questions. And so you'd have to buy the Saunders book, but a lot of the time you can find specific questions from your books from school. So I'm going to show you what the online Saunders looks like so you could go do some health and physical assessment questions. So you just log into your Saunders or your Elsevier, which a lot of nursing schools offer this to you, and you can go to study, click content area, and then you can see that health assessment physical exam has an arrow and you can press down on it and you can see that you have all the different systems that you can choose from to do your practice questions. Now just know, you're probably not going to do super amazing when you first start, but you have to start somewhere. And once you get into your adult health topics, you're going to be so happy that you've studied all those fundamentals topics. So now I'm going to go show you the meds just so you can see how to study them. So this is the table of contents for the meds, and you can see that I start off with med administration, and I am telling you guys, this is the most important things that you would need to know about meds. Then I go through the different systems for each of the meds. So this is the med administration Nugget page, and this one, you can't really find specific questions for med administration. You will find them as you go through the different systems and do the med questions from that way. And it's very basic stuff about what's a MAR and a med rec, how do you identify a patient, what's up with the doses on the Nclex, unacceptable abbreviations. So once again, you can go through this and read through the different topics for basic med administration, the meds and the antidotes, therapeutic levels, and of course I put some of the images in there so that you can see what is a buccal med, what is the vastus lateralis part when you're given IM injection. Now these are the specific cardiac meds, and as you can see, they're all written in charts, which I think is really good for keeping things organized. I have the classification. So here we have, for example, ACE inhibitors. They're antihypertensives. What are the names? So you need to know that they all end in pril. So if they give you a pril, you need to know it's an ACE inhibitor. But you need to know an ACE inhibitor is also the prils. You need to know what they're indicated. So what are they for? To decrease blood pressure and heart rate, prevent MIs and CVAs or strokes. This is the mechanism of action. So I don't put it in every single Nugget page because it's really hard to remember. But if you do need to write in any content, maybe that your teacher tells you that's really important, you should put it in here. Here are some of the common mild side effects, and then here are the killer adverse reactions. So you need to know what the difference is. Common mild means you need to usually teach them on how to deal with that side effect or how to keep them safe, versus a killer adverse reaction with a skull and crossbones is horrible. So you probably have to hold the med and call the healthcare provider. So what I want you to know, for every mild common side effect or killer adverse reaction, there is a nursing consideration that goes along with it. So you always need to assess for something, or make sure that the medication is working correctly when you are giving these medications. So for example, you would hold these ACE inhibitors if it was less than 60 or their blood pressure was too low. And because it can cause orthostatic hypotension, which is bradycardia and dizziness, you want to tell them to use caution when getting up. It can also cause hyperkalemia. So that can be mild or common because maybe it's not that high. Or if it gets really high, then of course it can turn into a killer adverse reaction and cause a cardiac dysrhythmia and kill them. So you just want to be aware of that. So what do you do about that? Well, you would check their potassium level and use caution if they have renal failure, etc. There's also a dry cough that can occur, so your nursing consideration would be to possibly change that to a different medication. Now here's the killer adverse reaction, angioedema. That's swelling of the face and the neck. That's horrible. So you need to assess their airway. If you see that, hold the med and call the healthcare provider. So I don't have every single side effect or nursing consideration on here. I just have the most common ones, or the ones that you really need to know in order to do your job. So now that you've gone over your cardiac meds, you can go into the online section or whatever question bank that you're using, and you can go practice some cardiac med questions. And so as you're doing those questions, you just want to make sure that you can remember the content and that you can apply it. So if you're getting questions about things that are not in this book, it might be some little detail that I just didn't think was super important to know, but if you want to write it in your book. This book is really easy to write notes in, and it's bendy, it's not super big, so it's really easy to carry around with you. To use the book for your studying, remember you want to do these 3 steps. Review the content, then go practice some Nclex style questions, and then write down what you didn't know in your book. If you don't have the book, I'll put the link below. Well, thanks for watching, everybody. If you like this video, just make sure you subscribe to my channel or give me a thumbs up. You can ask me questions in the comments too. Now for my next video, I'm going to be doing a review of this book. And so this is a book with case studies for the next generation Nclex exam. So that's going to be showing up in April 2023. And hopefully your nursing schools are already implementing these kinds of questions. But I'm telling you people, this is going to be important. So you want to make sure you know how to answer these types of questions. So look forward to that, and I will see you soon. Bye.